Going to do med administration on Mr. Kaufman, Bam Bam, birthday 9/8/1950. We're going to check to see on his MAR, what's scheduled PRN medications he has. He has the fluticasone propionate, forgive my mispronunciation. It's 2 doses, 2 puffs twice daily, inhaled. It's dispensed in an aerosol metered inhaler, 0.044 milligrams. He has furosemide, 40 milligrams daily, 0.9. It's a tablet, 40 milligrams, PO. He has the NaCl eye drop, 0.9%, 1 drop daily to the right eye. It's dispensed in a solution, drops. He has a nitroglycerin transdermal patch, extended release transdermal 0.4 milligrams an hour. And the patch is to be rutinite at 2100. And he has lorazepam 0.5 milligrams, 0.5 milligrams every 6 hours and as needed. PRN. It's a tablet, it's 0.5 milligrams PRN. Okay. So to pull our medicines, we have our nitroglycerin patch, we have our Lasix, also our Ativan, meter dose inhaler, and our eye drops. So what we're going to do is we'll double check. Mr. Bam Bam, 9/8/1950. We're going to go ahead and check if any allergies listed, none. Flow sheets. We're going to check his vital signs. Temp 98.2 this morning, and prior shift 97.8. Temp heart rate was 72 and 68 prior to shift. Blood pressure is 126/82 and 0.8. I'm sorry, 108/68. Heart rate, respiratory rate was for both were 18. SpO2 is 95. Early this morning and before shift was 94%. No pain. One concern I have with the nitroglycerin is the blood pressure. The 108/68. I would call the doctor and see if we're still good for a new nitro patch with the blood pressure that low. Let's go over to labs. As far as there's nothing in CBC. Sugar is top end of normal. Creatinine is fine. BUN is fine. Sodium is fine. Potassium 3.8 is fine. Nothing really setting my triggers on the labs. Okay. It's not the best. Here we are. Good afternoon, sir. My name's Jim. I'm your nurse. I'm taking care of you. We have some medications to give you today. First, we're going to do some eye drops. Then we have our inhaler. We have a nitroglycerin patch, and then we have pills. two different pills. One's your Lasix, and the other one's the Ativan for anxiety. While talking, I wash my hands. So let me do so the the inhaler that's it's a steroid, inhaled steroid that's gonna help you breathe better. Hopefully decrease some of the inflammation in your lungs. And then the Lasix is going to help kind of get some of that fluid that you may have on you. The nitro patch is to kind of keep that, we're going to keep that chest pain away, try to keep that down to a nice tolerable level. And the eye drops are going to kind of help with that irritation and maybe that kind of pressure you may feel in your eyes. So we're going to do first, if you don't mind, if I can just go ahead and get your blood pressure. Okay. So I'm taking the blood pressure. Blood pressure is 120 or 80. I'm going to check his heart rate. Okay, heart rate is 78. Count respirations. All right, beating about 20 times a minute. Sarah, are you having any pain at all right now? Any chest pain, shortness of breath, anything like that right now? No? Okay, thank you, sir. And some of these meds that we talked about here, are you allergic to any of these? The Flovent, the eye drops, nitroglycerin, or the Ativan, or the Lasix? Has anybody said that, or you got any reactions from it at all? No? Okay. What I'm going to do is I'm going to check his name. I'm going to confirm his armband. Mr. Kaufman, birthday. Could be Mr. Kaufman. Date of birth is 9/8/1950. I check with him. I check out his armband. Mr. Kaufman, do you mind if I listen to your lungs? Can you lean forward for me? All right. Thanks, sir. And now, if it's okay, if do you have any swelling or edema to your legs at all? Do you mind if I see? Come down, looking at his legs. Check to see if there's any edema. Lung sounds were otherwise unremarkable. Clear bilaterally, ×4, ×6. Sir, so are you feeling any distress? Any pain? All right. So, sir, let's start first with your nitroglycerin. If it's all right, if if you can kind of just like expose your chest a little bit for me, and what we'll do is kind of look at the site. Let's make sure it's okay, and then we'll apply a new one. Okay. So make sure my gloves are on. My nitro patch, bouncing the dose off my MAR, the extended release 0.4 milligram patch. Date of birth, Mr. Kaufman. First name Bam Bam. Date of birth 9/8/1950. Armband. Mr. Kaufman. Bam Bam. 9/8/1950. No allergies to these medications. So what we're going to do is going to take the patch off the chest, discard it. I'm going to change my gloves out, wash my hands. I'm going to get a 4x4, a little bit of alcohol, water, and just kind of cleanse the site. Remove all the excess medication. I'm going to check the site for any redness, irritation, anything like that. I'm going to come over and I'm going to write today's date on the patch, and then when I applied it, and then adhere it to his chest. Next, sir, if it's okay, we're going to get you your Flovent. So, do you feel comfortable taking this yourself? You do? Okay, thank you. So, since this is something I dispensed out of the Pyxis, I'm going to go ahead and give it 2 test sprays. I'm going to load the cartridge into the meter dose inhaler part. Push twice. Make sure that it's primed and ready for use. And I'm going to shake it for 3 to 5 seconds. So, sir, what we need you to do, if you can for me, if you can just go ahead and just do an inhale and then exhale slowly. And then what we're going to do is I'm going to hand it to you, and what I want you to do is put your index finger and middle finger on the top, and then your thumb on the bottom. I want you to put your lips around the part where the medicine comes out. Make sure that your teeth and your tongue are out of the way, and form a nice, good seal on the part where the medicine comes out. And then what I'm going to do is we're going to get 2 puffs, and we're going to do the first one. Let's try to hold it in for about 10 seconds. Then exhale, and then when you're ready, we'll give the second one. Okay? So he has it in his hand. He places his fingers in the index and middle finger and thumb in the proper position. Presses, inhales, holds for 10 seconds. Exhales. Okay, So when you're ready, let's take the other one. Press. Inhale. Exhale. Okay. And if since it was a two puff inhaler, we would wait like 20-30 seconds in between puffs. So at this time, what I just ask him to do is I would make sure to, since it's a steroid, that I'd have him just kind of rinse his mouth out, maybe brush his teeth if he's able to, and go ahead and just to kind of prevent from any unnecessary culture growth in his mouth. After giving this medication, I'm going to reassess his respiratory status. I'm going to listen to see here if there's any improvement, which I'm going to do now. All right, sir. Then we're going to have is the two pills we're going to have you take. So we have is I'm going to rewash my hands, put new gloves on. I have the first medicine I'm going to give is going to be the Lasix, 40 milligrams, PO, and have a little cup of water here so you can swallow it. I'm going to go ahead and check Lasix off the MAR. And I have 40 milligrams Lasix, PO, and checking on the MAR, Kaufman Bam Bam, check his arm, his band, Kaufman Bam Bam, that's Kaufman Bam Bam, 40 milligrams. And sir, if you go ahead and take the cup with the meds in it, go ahead and pop those in your mouth, and then go ahead and use this cup of water and go ahead and swallow that. Thank you. All right, and then here is your second one. This is going to be the Ativan. Ativan is going to be 0.5 milligrams. Bam Bam Kaufman, 9/8/1950. Armband, Bam Bam Kaufman, 9/8/1950. 0.5 milligrams of Ativan. So here's put the medication in one cup, water in another cup. Here, sir, if you can take that for me. Takes it, swallows it, follows with water. Thank you. And then last, we're going to do our eye drops. We have the NaCl eye drops. We're going to go ahead and bounce it off our MAR. And we have, we're going to do one drop to the right eye. So if I had, I'd have him, so I'd check off his armband, Bam Bam Kaufman, date of birth, 9/8/1950. of them are medications, the NaCl drops, um, one drop to the right eye. All right, sir. So if you can, I'm gonna use my hat to kind of demonstrate that. So what I'm gonna do is I'm gonna have him kind of tilt back, and I'm gonna use a super little towel to just kind of clean from kind of his lacrimal duct over onto his eye, kind of clear it out of any maybe dirt or cake or anything that's in there. And then I'm gonna look at his eyeball, just slowly pulling down. Check for any abnormality, any unusual redness, swelling. And then I'm going to go ahead and, with my clean gloves, I'm going to take the cap off without contaminating it. Oh, that should be this eye. I'm going to go ahead and place one drop, not on the retina, not on the cornea, just below it. And then what I'm going to do is I'm going to I'm going to have him close my eye. I'm going to have him look around while holding down the lacrimal duct, and then go ahead and release and open his eye. What I'm going to do is now I'm going to remove my gloves, wash my hands, and then I'm going to do a vital check to confirm, to make sure that we're not hypotensive from the nitroglycerin or altered from the Ativan, or reassess lung sounds for any changes, bad or worse, with the metered-dose inhaler. And that's it. So I'm going to make sure he's secure, comfortable in the bed, make sure the rails are up, make sure the bed's locked.